Welcome. You're listening to the Keeping Ashland Healthy podcast, a podcast production of the Mental Health and Recovery Board of Ashland County, Ohio. Thanks for joining us. And welcome back to another episode, Keeping Ashland Healthy with Dr. Ashley Ackerman and the boss, friendly boss, David Ross here at the Mental Health and Recovery Board.
Friendly boss, David Ross. I like that.
That's what I've heard people say.
People are saying that for sure. Yes.
Well, welcome back, Dr. Ashley, to this episode. We are going to talk about a recent conference that maybe some in the audience didn't have an opportunity to attend, but what I really like about the conference is they posted all the materials online, so we're going to talk about that. And then there's two mobile crisis services that are going to be, one should be available in Ashland County as we record this, but the other one is in the planning stages. So these mobile crisis services we wanted to talk about. And last but not least, on today's episode, something we've discussed before, but there's been some, I think, new resources put out recently about psychiatric drug withdrawal that we wanted to highlight for folks. And so I am excited about this discussion and hopefully what the audience will gain from it. So
I am too. Some good information.
But before that, how are you feeling, Dr. Ashley? Are you ready?
I am ready.
Okay. I want to make sure. I don't see any coffee in front of you. That worries me.
I know. It was too big to bring up here. It's on my desk.
I see. Well, if you're starting to get a headache, I can run down there, get that for you.
I can make it.
All right. Well, the conference I wanted folks to be aware of, our trade association, which is the Ohio Association of County Behavioral Health Authorities, we call it OACBA.
Yes. Or OACBA.
Some people call it that. I don't like those people.
I know.
Some of my board directors, they add syllables and nouns.
You told me that my first day on the job. You said, don't say OACBA.
Do not say that. That's not what it means. So anyway, OACBA, our trade association, partners with some other state entities to bring the Mental Health and Addiction Conference. And it's a statewide conference. And it's a multi-state. People come from all over for this. But the 2025 conference, we went last year for 2024, and that was a lot of fun. But it's not one of those things because it is a multi-day event. We weren't able to go this year because we got a lot of things going on locally. But what I love about the conference, they started posting everything, the keynotes, all the breakouts, everything gets posted, and they post it fairly quickly. Mm-hmm. And so I wanted the audience to know if like me, or even if you attended, you couldn't have attended. There was so much content. There was no way you could have got to everything. So I just wanted to make sure people knew that they had posted all the information from the conference, in that we are going to link that in the episode descriptions, today's episode description. So we had, several, Nicole Adams, Christy DeVry, Aaron Reed, Dr. Kennedy, Dr. Tim Fong, Melinda Moore, all those luncheon keynotes and morning, afternoon keynotes. Everything is going to be posted. I won't run through the list of all the breakouts, but they try to be cutting edge with what's going on with substance use and mental health treatment in Ohio, and then more broadly. So, look for that in the episode description. I just would encourage everyone to take advantage of it. It's obviously no cost to access it at this point.
Absolutely. It's really cool that they make that available free.
Yeah.
That's great.
And, I know some people will say, well, David, it's not quite the same. No, it's not, of course, quite the same as being there. But I think sometimes you can still learn quite a bit from the handouts and the PowerPoints.
And they can spark other thoughts and your own kind of research. So I like that too.
Yep. Well, then that leads us into our next two items. They're related, but we'll differentiate between the two. The first one, most folks in the audience will probably hear it described as MRSS.
Yes.
But of course, Dr. Ashley, we know in our field, acronyms, we have acronyms for everything, but
too many of them, actually.
Too many, yes. Yeah. But MRSS actually stands for Mobile Response and Stabilization Service. So I can understand why they call it MRSS. That's a mouthful. It's just like OACBA.
Yeah.
Right?
I'm just going to call it MRSS.
Mercy. MRSS, Mobile Response and Stabilization Service. So this is a service that has been around in other counties, but it's going to be a new service beginning July 1, 2025 for Ashland County. Yeah. So we're excited because, quite frankly, we don't know the positive impact that it's going to have, the extent of it. I know it'll be helpful, But because it's brand new, we don't know exactly to what extent it's going to be helpful.
Right. Yeah.
So the basic premise for our audience is we understand that a crisis can happen at any time, anywhere. Mobile Response Stabilization Service is really focused on youth and family crisis. And I think it's primarily focused on either the school or the home environment. We know sometimes that a crisis episode, if a trained, educated resource team can be deployed, whether that's a school or home, that they can hopefully de-escalate that situation, provide information, maybe referral information, follow-up information to either the youth or the family and help avert that crisis either recurring or escalating even further than what it is. So I think that's the overall big premise.
Yeah, I kind of read a little bit about that before.
Okay. What
the
would you read
podcast.
there? I'm glad you're reading, Dr. Ashley.
Yeah, for sure. I thought it was interesting. So the MRSS team responds within 60 minutes of a call. So they're
Rapid response.
Yeah, so that's good, and it's in a part of a crisis that might be kind of escalated. They can kind of step in, de-escalate that situation, like you said. Also, they're assessing the strengths and needs of the family or the child.
I like that strength focus. That's something that we believe strongly in here at the board.
Absolutely.
Yeah.
So how can they use their strengths to get through the situation they're going through, and maybe what resources do they need? I like that. And it's a no-cost service for Ohio families.
That's huge. So most of the funding comes through Department of Medicaid, and then there's some additional funds that are braided with it from the Department of Mental Health and Addiction Services. And again, they changed their name recently.
Yeah, is it officially changed now?
Yeah. With the law, the governor signing, it's Department of Behavioral Health.
Okay.
So anyway, but yes, so those two are putting up the funds. So as you said, Dr. Ashley, it's this is a service that'll be at no cost to the folks that utilize it.
Yeah, I think that's nice.
Yeah. What else you got there in your notes?
Those are the most important things.
Yeah, no, that's that's super important. The idea that they get there quickly within an hour, that it's not going to be a cost, and they can return to the family. It's not like it's a one and done. I mean, the idea is short term. It's not intended to be an ongoing service, but we know that there it could be from the family end, it could be on the youth end, but tensions, disagreements, things come up. There's a variety of scenarios I can think of that would cause some tension. And I think the audience can think of any, whether it's academics or it's relational. Could be changes in the mom and dad relationship. It could be a living situation. It could be, like I said, grades and sports and health issues. There's just all manner of things that could lead to, stress. And these MRSS responders, again, these are trained counselors, social workers, peer people that would be mobilized to come out and again, provide hopefully a perspective that's different and kind of some hope and some tools that would be useful by the youth and the family to help not only with that immediate crisis, but the ongoing crises that we all face as we go along in life.
Yeah, I like that you said that, like the outside perspective of that person could be helpful.
Yeah.
Like kind of like when couples go to counseling, that third person, that third perspective can help kind of mitigate the situation.
Yeah.
So.
Yeah. Well, typically, if we're in a crisis, our perspective can become a little skewed.
Absolutely. When you're emotional, definitely. Both parties are probably not seeing clearly,
so
or communicating.
So hopefully the MRSS folks will bring that more objective kind of perspective. And, one of the things I know people will ask is, how do I get a hold of these folks? Well, we're being told that the easiest way is to dial 988. So supposedly the 988 line will, if you explain the situation that you're looking for MRSS, they will route you to the team that will then be deployed. Now, I will say, audience, be a little patient because patient with us. The board doesn't fund this directly, but it is something we want to talk about because it will impact our community, and we think a positive way and potentially a significantly positive way. But it is new. And I know Appleseed is the agency that's going to be employing the team members, but I'm not sure they're 100% staffed and trained. So I know they're partnering with the MRSS team that's already up and running in Wayne Holmes counties.
Yeah.
So I don't know exactly who will be deployed and mobilized when you call 988 if you're in Ashland County, but I know it'll be maybe some combination of folks working at Appleseed and or the MRSS folks that are already established in Wayne and Holmes County.
Yeah, so that's great.
But I say be patient. Talk to Jerry, Stacy at Appleseed if you're having any issues with the response after the fact, because we all want to learn, what we can do better. And you know how it is with any new program. I'm sure there's going to be some learnings where we can make improvements. That's just the nature of these things. Mm-hmm. The other things that we're excited to learn is how we can best partner with law enforcement, schools, children's services. These are some of the other entities that might be involved depending on the situation with a young person and family. Mm-hmm. So how's the team going to partner with them in a coordinated fashion? Let's be honest, they might try to de-escalate the situation, but maybe it's not a situation that can be de-escalated. Mm-hmm. And maybe it escalates to the point that, safety is an issue and maybe either the team or somebody else has to get 911, law enforcement, just to make sure everybody remains safe during the episode. So there's going to be obviously some overlap, I think, with law enforcement, possible overlap with the schools if they're responding to a school, which I guess is pretty common. And then children's services, again, that could be whether they're involved at whatever level. That might be another organization that I see that we'll have to just partner with. The team will have to partner with just to make sure everybody is aware of what's going on. And communication. We talk about this all the time in our work, how critical that is for everybody to be on the same page.
Yeah. So I'll be interested to see what happens. I think the intervention early on, hopefully that leads to less law enforcement involvement with kids and families, hopefully, right? Hopefully less CPS involvement, although that's inevitable. But I think that's the goal, to intervene and offer resources before they get to that point.
And absolutely, this is for our law enforcement partners that listen to the program. Absolutely, this is intended. Those maybe calls that you get that are low level. They're child parent kind of issues, and maybe law enforcement is getting called out multiple times, and it doesn't seem like things are getting better. Maybe the family's not seeking after services, even if law enforcement provided them with potential resources. Yeah, this team could be called instead, hopefully. Maybe be more persuasive as to why and how these resources, maybe even attempt to go with them in some way, be more active in linking and connecting them. I think that could be a real bonus. So, but you're right, Dr. Ashley, the overall goal is that, these other entities like law enforcement wouldn't have to keep returning to the same house and home or school, with the same typical crisis, if you will.
Right, yeah.
So, well, that is MRSS, Mobile Response and Stabilization Service, new service to the county. We are hopeful that it has a positive impact, and more information on it in the episode description. But that leads us into something else that the state, now this new Department of Behavioral Health, again, it's going to take me a while, audience, to get used to that, because it's been Mental Health and Addiction Services for about 10 years. So before that, it was something else.
What is the new name?
Department of Behavioral Health.
Department of Behavioral Health. Yeah, got to work on that.
Right. So the other thing that they are promoting, and now this is not, audience, this is not in effect yet, but they would like to also have, similar to MRSS, MRSS for adults, if you will, so Adult Mobile Crisis Response. So this would work, I think, in a very similar way, where there would be teams to respond quickly, hopefully within an hour, but the focus would be more on adult crisis, and how can that adult crisis be de-escalated in the community such that maybe the person doesn't need to go to a hospital level of care, or maybe they do. I mean, maybe that's the result of the evaluation and the assessment, and that could be facilitated as well. But it's the same concept, but just focused on adults.
On adults, yeah. I think that could be helpful.
So, there's some listening sessions that the state is scheduling with boards like ours, and our crisis partners like Appleseed, and with peer organizations like Catholic Charities and the Pathways Program. So we'll be attending that here in the next couple of weeks and learning more. But I just thought it was important that the audience know that that's coming. So the MRSS, so that mobile response for young people has started, but the one for adults is coming. And again, these are both new, Dr. Ashley, and most of the audience knows, or if they've heard me talk in public, we've always had very limited resources. We love our levy. We appreciate the voters that have supported that over the last 25 years almost. But we still have relatively, I would say, meager funding to invest in behavioral health services. And the board does its best to be very prudent and thoughtful and efficient. But these services are wildly expensive services for the audience. I think audience members understand what a firehouse is, a fire station, right? So basically you've got folks available living there at the station, ready to respond to fires if they occur, but they never know when and how many.
Right. So you have to be ready always.
They're always ready. So it's the same model for these MRSS and adult crisis. You have to have the team, and the team could be, like I said, counselors, social workers, case managers. They have to be ready to respond. They don't know in the crisis when they're going to be deployed. So they're not allowed to be doing other things. They're not allowed to be like in session, right? Talking with somebody else and then have to drop that and say, oh, got to go.
Yeah.
Just got a call. So
they have to be available.
So they have to be available by the standards of the program, which means that they're paid regardless.
Yeah.
So as you can imagine, that's kind of an expensive proposition for whoever the funder is. So looking forward, we'll see how these pilots go, because I think that's probably the best way to view them for us. They're new. The board's not funding them yet, but if they're super successful, I would think we'd want to continue them. The challenge then will become how can we fund this over the long term, because they are very, very pricey.
Yeah, I think definitely funding is a challenge, and also workworkse.
Yes.
Right? We've talked a lot about that.
Yes, I appreciate you bringing that up. So, audience, we've talked about this before, but the young people that are interested in working community behavioral health has kind of dropped. There's some things being done, I think, at the state and local levels to hopefully make our system more attractive to younger folks that are graduating or thinking about what to major in. Yeah. I don't know if we've been as successful yet, but the idea is we need more folks that want to work in. And to be honest, a lot of folks, even if they do want to work in community behavioral health, don't want to work in crisis. It takes a special person to do crisis work.
You're right, yeah.
So I think workforce will be a challenge as well as the funding aspect. So, so those are two new and emerging crisis things that are truly new, not only for the state but for Ashland County specifically. So I wanted the audience to know about that and excited about it. But again, questions that we have, and we're always trying to do our due diligence when new services come to town. So
it's good information.
Well, last but not least, in terms of our topics, Dr. Ashley, is one that is near and dear to us: psychiatric drug withdrawal. So, the concept here is if you or a loved one has been taking psychiatric medications, one or more, for any length of time, it's very, very likely that if you or they choose to stop taking that medication, almost always, again, I can't say in every situation or instance, they're probably going to experience some kind of withdrawal effects. And I like to use the example because my mother drinks way too much tea and I drink way too much coffee, but I'll throw her under the bus because she's so sweet.
She is.
When she doesn't drink enough tea, she starts to get a headache. And that is because she doesn't have enough caffeine in her system that her body needs to, quote unquote, feel normal.
Yeah.
So part of withdrawal, she basically doesn't have enough caffeine. That's a side effect for her. That's a drug effect of being caffeine low.
We need to stage an intervention with Ava's mom.
We may have to. So with psychiatric drugs, like I said, if an individual's been on one or more for any length of time, the body does become accustomed to having these drugs in the system and functioning with them. So if the person makes a decision to taper off, to come off, it is not unusual at all for the body then to experience these drug withdrawal effects. Now, the research, the materials, the education on this whole process and what to expect and how to taper off has been really, really scant. There has been very little done until just recently.
It's emerging. Yeah,
it is
I'm
emerging.
excited about this.
So that's why we wanted to bring this to the audience attention. And again, don't worry about writing this all down if you're listening in the car, or we will put these links in the episode description. But we want you to be aware of 4 specific resources that have emerged now to help all of us, whether you're individual, family member, understand better. I mean, this goes for psychiatrists, prescribers as well.
Yeah.
The Maudsley Prescribing Guidelines. This is something that came out from England. It is technical, but still, I think, readable for a lay audience.
Yeah.
It just basically helps give guidance on how to come off. So the idea of just cutting by 50% one week, cutting it by another 50% the next week, et cetera, that doesn't work for everybody. In fact, it doesn't work for a lot of people. So the idea of hyperbolic tapering or gradual tapering. So the deprescribing guidelines talk about that because it depends on the person, depends on the medications, the drugs. It depends on how many, how long. There's a lot of considerations for this.
And that form of tapering is tailored.
Yes.
So I think that's what kind of makes it different than just having each week like you're saying. That's kind of traditional.
Yep.
But this would be tailored based on, how the person is reacting to the tapering and what they need.
Exactly.
Yeah.
And the other thing is, as you taper to lower doses, there's not necessarily a pill or a form of it. So there's some guidance in there about, where do I find 2 milligrams of this thing that's not sold in anything less than 10?
Yeah.
Right. So that can get challenging. That's why we need the professionals, the pharmacies and the prescribers on the same page with this. So that whether that's compounding, but there's various ways that they can approach that to help the person get that smaller dose that's not typically sold.
Yeah. Good point.
There's a lot in that. So that's the Maudsley Prescribing Guidelines. And then an old friend of mine, Laura Delano, this is a book that in some ways she's been writing since she was a teenager. And I became aware of Laura when she started to blog on the Mad America site many, many years ago. I mean, it's got to be over 10 years ago. And Laura had talked a little bit about her journey of, just being diagnosed and her journey of different and various treatments over the years, how she did with those, how she didn't do well with a lot of them, her experiences with medications, and then her experiences when she made the decision to come off. So all of that is really captured well in her new book, Unshrunk, A Story of Psychiatric Treatment Resistance. Laura is a powerful advocate now, helping other people do what she did, which was basically come off psychiatric medications. And I think it's a hopeful story, but she doesn't pull any punches. So I just want folks to know before they buy it. I mean, it can be raw. It could be very honest, like another person we're going to talk about. And I've noticed that these folks they're advocates. They're passionate advocates because it happened to them, and they really come at this. They don't want other people to be, I don't know, unsupported or not feeling like there's anybody. Because when Laura and Brooke, who we'll talk about later, they didn't feel like there was a lot of support, a lot of guidance, a lot of information. Like they felt like they were on their own in doing this big thing. And it's like, well, how is that possible that I should be on my own doing this big thing? And why wasn't there more support or education or information to help me do this? Yeah,
one of the most important things I think regarding all of these resources is that they provide more informed consent. So if someone's deciding to go on medication, they should know about the process to come off. They should know about the potential
from
of
the
withdrawal.
very beginning. Is that what you're saying, Doc?
To make that decision, you should be aware of those things. And I don't think that people are very often.
Yeah.
So,
well, similar to the Maudsley Prescribing Guidelines, Anders Sorensen, he has a new book out called Crossing Zero, The Art and Science of Coming Off and Staying Off Psychiatric Drugs. So Anders' work, I think it's just a more readable, easier to understand perhaps book, but it's in the same realm of the Maudsley book. Anders, I've seen some of his interviews and some of his Substack, some of his pieces that he writes. I just think he's more approachable. Maybe he's a young person himself, actually. But again, his new book, we'll link to that, Crossing Zero. talks again, how do we do this? And I'm excited, even though it's similar to Maudsley, the fact is we didn't have any of these a few years ago. So I want more.
Yeah.
It's okay to have multiple books on the same basic topic. I'm perfectly happy since we had 0 for so many years.
Maudsley was literally last year.
Yeah, I mean,
2024. So.
Yeah, that's true. These are all new. So,
and I just wanted to say about Sorensen, I think what kind of set that apart, I haven't read it, just to preface this, but I think what sounds interesting is that it addresses life after medication. So I read online, it's not just about stopping drugs, it's about what comes next. The concept includes the challenges and opportunities of rebuilding identity, relationships, and coping strategies without the influence of psychiatric medication. Yeah. And that's kind of like that next step moving into that, which is interesting to me.
No, it is. And you just said something. So, I mean, this is a question I've heard. Who am I off these medications?
Right. You start taking meds at 13.
Correct.
Your identity is built around being on meds. Yeah.
Yeah. Who am I? And these are big questions, and how you experience life now off medications in relationship. There's just big things. And our last mention here, Brooke Seam, who was our keynote this past year at our RSVP, she's, again, really active in this space. She's trying to figure out, she sees a lot of lost years when she was on the medications because she didn't experience some of those key moments in life where she experienced them maybe differently than she would if she wouldn't have been on medication. So she's trying to recover and go forward in some ways. There's
a sense of loss surrounding like what she didn't have and what she missed out on, I think, in experiencing life the way she did. Yeah.
So Brooke Seam, I'm also going to link to her blog because she's doing some ongoing, I think, good work, very similar to these other folks. Her book, we've talked about before, May Cause Side Effects, which is a wonderful book. That's still available, and that'll be in the episode description. But so the Maudsley, Lord Delano, Anders, and Brooke, 4 incredible resources that literally, Dr. Ashley, weren't even around just a couple years ago.
Yeah, I'm excited to see how this takes off. I hope that this keeps growing, this movement. So
I think so. Audiences aware, obviously, of some of the settlements with Purdue Pharmaceuticals around some of the medications that were being, some of the other painkiller medications that were being prescribed but marketed in ways that weren't honest or accurate or scientific. So I think there's going to be I think there's more of an awareness by the general public that they need to be a bit more careful, cautious, ask more questions, regardless of it, whether it's a painkiller or a medication that changes the way the brain works.
Yeah. Well, and I don't think that people are always aware that they can ask questions, that it's okay to say, I need to know more about that before I take it, So this is an important topic.
And I love what you said, Dr. Ashley, about, from the very beginning, listen to what Dr. Ashley is saying. I agree with her 100%. If you or a loved one are considering beginning one or more psychiatric medications, you need to ask from the beginning, what's the potential side effects, certainly, of taking them, but what are what's the process? What should you expect once you get off of them? From the very beginning, you really need to be thinking about side effects while taking, but also side effects in the process for tapering.
Right.
Once
and
you decide to get
how long am I thinking I'm going to be on this medicine? How long does a doctor think that is appropriate for that?
All that should be talked through, I think, from the beginning. And that's one of the things we're going to continue to stress that because you just can't, we need to make that a norm that both the people seeking treatment ask for that, expect that, but also that, the prescribers share that.
Absolutely.
So they make the context, that interaction, just make that a normal part of the process, not something extra.
It should be.
Yeah. Well, program note, Dr. Ashley, as we're winding up the show, I should let the audience know that this is, in fact, your last episode.
It is my last episode. Well, unless you have me back as a guest or something.
Well, that's true. I could have you back as a guest. But the reason this is Dr. Ashley's, she, if it's okay to share.
Absolutely.
Dr. Ashley is going to be teaching at Malone College.
Malone University.
University, sorry.
Yep. I'll be teaching in the psychology undergrad program and the counseling master's program at Malone full time.
I know. So that is going to be awesome for all you students that are going or thinking about going. Yes, you want to be taught by the Dr. Ashley.
Aww.
So
Yeah,
we're
I'm
looking
excited,
forward to this next adventure for you. I think you're going to do wonderful. And, of course, we're going to miss you on the Dr. Ashley and the Boss podcast, which will probably have to change its name.
Just the Boss. We got to think of a good name.
I'll have to think of something.
Yeah. Thoughts with the Boss.
Yes.
If you have any ideas, send them. Send them to MHRD.
Yes, please, audience.
But yes, I'm going to miss doing the podcast with you. And I thank all of the listeners for your support in this.
Yep. And I think I will hear about this. I already have from a lot of people that have found out that you're moving on. They really appreciate and they're going to miss you. And I can say that's true for me as well. But
thank you.
So we don't both tear up because we
can't do that.
We are counselors. We will end this episode. But thank you, Dr. Ashley, for all your efforts on the Keeping Ashland Healthy podcast, but also for all your work you've done in Ashland County.
And thank you so much too.
Thank you for listening to another episode of the Keeping Ashland Healthy podcast. The podcast is a production of the Mental Health and Recovery Board of Ashland County, Ohio. You can reach the board by calling 419-281-3139. Please remember that the board funds a local 24/7 crisis line through Appleseed Community Mental Health Center. It can be reached by calling 419-289-6111. That's 419-289-6111. Until next time, please join us in Keeping Ashland Healthy.